All right, guys, we're going to stick with the triathlete theme here, and we're going to talk about knee pain today. So we all have two knees, right? The knee is a very unique joint in the body because it is actually a stability joint. So when you look at the kinetic chain, we alternate mobility and stability joints, starting with the ankle. The ankle is designed to be very mobile. The knee is designed to be very stable. And then above the knee is another mobility joint, the hip, okay? So why that's important, what we see in the stability joints in the body, a lot of times the pain that we deal with in the knee can be transmitted up the chain at the hip or from below the knee at the ankle. So we always want to make sure we evaluate those joints as well because they're a major player in knee pain. But let's say we just realize that, okay, where the hip is clear, the ankle is clear. What do we look for in the triathlete when it comes to knee pain? Some of the more common conditions that we see, the first one is something I call runner's knee. I think this is an underrated condition. It comes from the back of the knee, a little muscle called popliteus. I'll put a little graphic here on the screen to show you what that looks like. We'll deal with patellofemoral pain syndrome, which is a misalignment of the patella. We'll talk a little bit more about that. And then also just imbalances in the quads. So like because the knee is such a stability joint, minor imbalances can cause pain, any sort of rubbing or just kind of grinding and friction type response in that lower or bottom side of that kneecap, and that could be a pain generator as well. Of course, with the knee and any stability joint, we always want to rule out any sort of serious injury, ACL, PCL, medial meniscus, lateral meniscus, MCL, LCL. So all those things we want to make sure are intact. Odds are if you didn't have a big ouch moment, that those things probably aren't an issue. So we're going to stick with more of the repetitive types injuries for the purpose of this video. Okay, so we're going to start with some of the low-hanging fruit in the knee. A lot of that revolves around the patella. Symptoms that we see with patellar tendonitis or patellofemoral pain syndrome is often pain when going up or down stairs, pain when getting up from a seated position, anything like that, just walking in general, or pain when you're on your first or second mile. Like that pain gets worse as you progress into the run. And what happens with that is on the underside of the patella, there's a triangular shape of that underside of the patella, and that should glide directly into the patellar groove. So there's a groove that the patella sits in, and if it's shifted in that groove, it can cause a rubbing or friction type pain on that area, and can actually wear away the cartilage over time, causing something called chondromalacia patella. Hopefully we're not dealing with that, but how we treat this with ART in our office, just some patellar tendonitis, quadricep tendon we'll hit, and then we'll actually hit a little bit of the lateral IT band there as well. We'll have the patient in this position here. We'll hold that tendon, and you're just going to go ahead and bring your heel to your butt. Good. So you can see my thumb is right on top of that tendon there. That's the quadriceps tendon. That's right where that reaches that top side of the patella. Keep going. Good. Good. So we'll hit that, and then we'll come down under here, get the patellar tendon. Go ahead. And the patellar tendon is just a extension of the quadriceps tendon, actually. So it lengthens in knee flexion, it shortens in knee extension. So that's why we're always stretching with ART from a shortened to a lengthened state. Go ahead. Awesome. Then we'll hit the lateral IT band. So the IT band is actually opposite. So what we'll do is we'll have you start with your heel to your butt. Normally, I'd be sitting on this side of the table to get a better contact, but what I'll do is I'll grab my thumb here on the outside, and the patient will go ahead and extend their knee, and that's a great stretch for that distal IT band, which actually can be pulling the patellar out of its groove, so that's a really big one to hit in this position. So this is one of the more common pain generators in the back of the knee. It's a muscle called popliteus. It runs just like this, and the way we'll treat that, and this is actually very effective treatment here with ART, we'll bring the knee into a flex state and a little bit of internal rotation of the knee, okay? The job of this muscle is to lock the tibia on the femur. So a lot of times if it's stuck in contraction, what it'll do is it'll keep it stuck in that locked position. So we want to unlock that knee. So I'll get some tension on that popliteus. Under internal rotation, I'll keep that tibia internally rotated, bring the knee into full extension, and then I'll externally rotate a little bit. Patient will feel a nice stretch right underneath my thumb. This is a common site of pain again in runners. So this is very common. I do this technique probably once or twice a week. Patients, it's pretty common area. So whenever I'm working a stability joint like this, or really any joint, I want to make sure I work completely around the joint. We hit the front side of the knee with the patient seated, the outside of the knee with the patient seated. We hit the back side of the knee with the patient laying on their stomach. And we'll finally hit the inside of the knee with the patient laying on their side here like this. So in this position, I'll work the back knee. This is an inside quad muscle. If you've ever dealt with patellar pain, you've heard vastus medialis or VMO. Those are buzzwords for this type of condition. So we want to make sure we're targeting that with our ART here. So patient's going to extend the knee. So go ahead and just hold that extension. Contract your quads for me. Good. I'm going to get a nice solid contact through there, and they're just going to bring their heel to their butt. So again, we're working from extension, a contracted state, to knee flexion, a lengthened state. And we'll, as always with ART, we'll hit that in about 5 to 7 moves. Go ahead. We won't do that for the sake of this video, but that's the goal there. So I'm feeling that tension build under my thumb. I'm sure Lizzie's feeling that tension build in her knee. This is a very good stretch. If you're a triathlete, odds are you've dealt with one of those ailments that we just went over. A little sneak peek on how we treat those techniques with ART. If you have any questions, or you're dealing with knee pain and maybe we've helped you with a different condition in the past and you didn't realize we worked with knees, feel free to reach out to us with email with any questions. You can shoot us a comment or any sort of message. We'll be happy to help you answer any questions you may have.